colon cancer. Senior Moment with Nurse Linda. Today we're talking our third segment of the silent killer is one that strikes the fear in the heart of every man.
And woman.
Women have colons?
They sure do.
No kidding. I'll have to check. This is Senior Moment with Nurse Linda. That's Nurse Linda. This is Dr. Charles Campbell. I hope you're enjoying this because it's really fun and it's good information.
This is an interesting group of topics, and cancer is my first love. I'm an oncology nurse from way back when, and that's why I have the stories to go along with this. And I'll start off with a story with colon cancer. Colon cancer is one of those cancers that can be considered a silent killer because it does hide, set up housekeeping in your colon, and doesn't provide a whole lot of symptoms until it's fairly well advanced. It can also have a family history of it, and like many family cancers, every generation it tends to present itself about 10 years earlier each time it goes through. So if your grandfather had it at 70, you may have it at 55 to 60. Your child may have it at 35 to 40. And eventually, we had a gentleman come in, strong history in the family, brought his 17-year-old son in, kicking and screaming, for screening. Kid didn't want it. They finally said, yes, we're going to put you through this. He was found to have cancer at 17 years old. And it's only because that dad insisted on it. So it's very important. Pay attention to symptoms. Know your family history.
It's not always genetic, is it?
It's not always, but it can be.
My grandfather on my father's side lived to be like 99. I think he was shot by a jealous husband. But my dad died in his 50s with colon cancer. He smoked 5 packs of unfiltered Camel cigarettes a day his whole life.
Yes. Yes. And those are some of the risk factors. The causes are unknown. Some people are saying that, chemical exposure, not having a good diet, having irregular bowel habits, a long history of constipation can put you at a higher risk of causing colon cancer. Being over the age of 60, being African American or Eastern European, having a diet high in red meat. We're not talking that occasional nice cow that you want to eat, but high, like every day, 6-7 days a week, you eat nothing but red meat. Having colorectal polyps, a history of Crohn's disease, ulcerative colitis.
Crohn's disease.
We're going to have to talk
Crohn
about
is a
those.
little old lady crumpled over.
Not that kind of Crohn.
Cookie.
Spelled differently.
Okay.
But we'll have to talk about Crohn's disease and ulcerative colitis. That's a whole different set of issues. A personal history of breast cancer will put you at higher risk of colon cancer. They don't know if it's the connection between the cancers or if it's actually due to the chemotherapies you received to treat the breast cancer that put you at higher risk for the colon cancer. Those studies are ongoing now. And familial and hereditary diseases. They call one of them HNPCC, hereditary non-polyposis colorectal cancer. The other
that's
one,
a mouthful.
yes, familial adenomatous polyps, FAP, all reasons to put you at risk. Symptoms, abdominal pain, blood in your stool, even if it happens one time. It needs to be addressed appropriately. We're going to talk about some of the diagnostic things that can be done. A change in your bowel habits. You were that person, and it's a pleasant subject to talk about, but moved your bowels every day.
See, people don't talk about it, and then they die of
And
colon
that's the
cancer.
problem.
Sure.
Okay? Everybody does it. I'm sorry, I don't care who you are. But you have a regular, you go every morning, your routine, and all of a sudden you start going every other day. Every third day, then every day, then every fourth day, then every day. And those changes can be indicative of something happening. You alternate between constipation and diarrhea, and you never did before. Your stools become narrow. It looks funny, but turn around and look.
When I was in Germany, the toilets had a little platform that your stool fell on, so you get just, okay, that looks okay, and you flush it away. That's Germany.
You can still turn around and look. And in Germany or not, unexplained weight loss, very important symptom. Your colon is where you absorb the nutrients from your food. And if you're not absorbing those nutrients, it's literally going to be running through you. So unexplained weight loss is important. There are screening tests for this.
I took one. It's like a little matchbook with a little, tear out a little strip,
Mm-hmm.
dip it in a stool, put it in an envelope, send it back.
And send it back. And that will tell if there's blood in your stool, because you can't always see that. Blood in your stool is not always red. Sometimes it's dark in color. If you have a black stool, it almost, people have described it as being coffee ground or black in color. It depends on where the mass in your colon is as to whether you're going to have red or black. That's the difference. There's colonoscopies and sigmoidoscopies. Not pleasant tests, but they're not unpleasant either. The doctors are making them very simple these days, but you still have to go for them.
Flexible sigmoidoscope.
Sigmoidoscopy will only view part of your colon. It only views what was called the descending colon. Colonoscopy will view the entire colon. That's the more complete test, and that you should have done at least once every 10 years once you start reaching the age of about 50. Very important screening tool. The doctor may also do complete blood count, liver function tests or blood work, and something called the CEA, carcinoembryonic antigen, and that also helps to determine could you have a colon cancer. Diagnosis is made when something shows positive. They'll do a CAT scan, an MRI, they might even do a PET scan, which is of the entire body. They'll do a biopsy. They'll take a little piece of this to determine if you have it, and treatment is dependent upon what stage of diagnosis you have. So it might be surgery, could include chemotherapy, radiation therapy, but colon cancer is very treatable. It's easily diagnosed if you pay attention to the symptoms. Don't ignore, again, those vague kinds of things that come and go.
It's worth your life.
Absolutely. Absolutely.
If you have any questions, do you have any of these symptoms, see your doctor.
Absolutely see your doctor. And again, don't take everything's fine. If you're still not feeling well, push it, go get a second opinion. Very important. Better to have two people say, yep, everything's being handled correctly, you're okay, than to you sit there and wonder, is my doctor really correct? I don't want to hurt my doctor's feelings. We'll have to do a whole segment on that, getting second opinions. But
Yeah. Doctors don't mind second opinion, do you?
Some of them do, and people are afraid to hurt their feelings because they're such a nice doctor. Any doctor worth their weight in gold is going to invite you, take this and get someone else to read it.
Let me see. If I have a choice of hurting my doctor's feelings and asking for a second opinion or dying, I got the answer. You're listening to Senior Mobile with Nurse Linda. Call in number 803-941-7231. 803-941-7231. And we will be having call-ins on Skype as soon as our new setup gets here, our new studio.
Yes.
Massive studio. And we've been talking about colon cancer.
Yes.
Really, I said you have a colon. I was thinking prostate.
Yes. No, we're going to do that another time. Yes.
We did prostate, didn't we?
No, haven't done that yet.
Colon cancer, we did.
Yes.
How confusing. I'll have to watch this again. Thanks for listening again. See you next week.